SAEM. My name is Michael Ehmann, and I appreciate the opportunity to share with you this study wherein our group from Johns Hopkins analyzed some effects of our residency program's transition from a 3-year to a 4-year niche-based format. But first, neither I nor Drs. Klein, Kelen, nor Regan have any financial disclosures, although Dr. Regan is a member of the ACGME RRC for emergency medicine, although this work does not reflect her responsibilities in that role. So over the past decade, the number of emergency medicine residency programs in the United States has increased by nearly 2/3. And as you all know, these programs exist in two different formats, 3-year and 4-year. But as the total number of training programs has increased, so too has the proportion of these that are 4-year programs. In fact, as of last year, a quarter of all EM residencies were 4-year programs. But why? Well, the ACGME has very strict requirements for 4-year curricula, which are copied here on this slide. But for medical students applying to EM residency, or for residents themselves, or for potential employers of graduating residents, one might ask, well, what does a 4th year actually get me? Now, of course, there are many good and reasonable answers to that question, but unfortunately, there just haven't been any data to describe potential differences between a 3-year graduate and a 4-year graduate. Which is why July of 2008, when our program transitioned from a 3-year program to a 4-year curriculum, we recognized that we could use this transition to compare our program against itself under these two different curricular lengths, while everything else remained static. We tested this hypothesis that a 4-year program with specific goals would increase residents' likelihood of pursuing careers in academics, of obtaining a leadership role in their first post-residency job, and of producing scholarly work during residency. So we designed a retrospective analysis of prospectively collected outcomes for 3 years of graduates before our transition and 5 years after. First, we collected their demographics from ERAS, including gender, USMLE score, advanced degrees in addition to an MD or a DO, and publications prior to beginning residency. We then collected graduates' first post-residency job position, as well as their scholarly work, both at graduation and again at 12 months post-graduation, to capture any additional work that was initiated during residency. These were our outcome measures. Initial job setting was defined as either academic or non-academic, leadership position as any titled role, and scholarship as posters, presentations, and publications. Our comparison groups were similar, although the 3-year residents had a higher percentage of graduates with advanced degrees, and the 4-year cohort had slightly higher test scores. But after controlling for gender, USMLE score, and starting the program with a prior publication or an additional advanced degree other than an MD, there was no statistically discernible association between obtaining an academic position and training in the 3 versus 4-year curriculum. However, once fellowships were excluded from this category, 4-year grads were significantly more likely to obtain an academic position after completing the 4-year program. We also found that 4-year graduates were over 13-fold more likely to obtain a leadership position immediately after residency compared to their 3-year peers. And while there was no statistically discernible association between the production of any type of scholarly work and training in the 3-year versus 4-year curriculum, graduates of the 4-year program were nearly 4 times more likely to produce at least one peer-reviewed publication by the time they finished residency. This finding was maintained even after controlling for the additional 12 months of time that 4-year graduates had to publish their work compared to their 3-year colleagues. Now, of course, this study has limitations. One, our data are derived from our single academic center, and while we believe that there were a few significant structural changes to our institution during this transition, there may have been some unmeasured factors that we just didn't consider. And furthermore, we were unable to control for all the variables that might affect a resident's decision to pursue academics or scholarship or leadership after training, but we attempted to account for our 4-year program attracting a more academically driven applicant by controlling for those pre-residency publications, USMLE scores, and advanced degrees in addition to a doctorate, which were all kind of indirect measurements of academic tendencies. Next, our data set included a relatively small number of study participants, which is merely reflective of the fact that we take only 12 residents annually. Third, even though our data collection was standardized, it's possible that we missed some publications or book chapters or presentations. And finally, 3 of our authors were very involved with the residency program during the study period, so we could have tried to skew the data to show 4-year superiority, but we didn't. So in conclusion, these data show that a 4-year residency curriculum is more likely than a 3-year program to produce emergency academicians, leaders, and academically productive emergency physicians. So those interested in similar outcomes should consider 4-year residency training programs. Thanks for watching. Please feel free to email me with any questions.